Veterinary Neurology Journal article reviews will cover accuracy of 3D printed animal-specific drill guides for implant placement in canine thoracic vertebra, a cadaveric study. It was first published in Veterinary Surgery in December of 2020, but prior to this, the study was presented as an online abstract or poster at the annual forum for the American College of Veterinary Internal Medicine. The study comes to us from North Carolina State University. Please look on the Veterinary Surgery website or PubMed for more information on the authors. For me personally, anytime I've seen a publication on 3D printing, I'm very intrigued because it is an area of high interest for me. So let's dive right into the introduction. I think this group does a really good job with the introduction, and I'll just hit on some of the highlights or key points. As this paper is investigating placement of spinal pins, the reason for the need for spinal stabilization are brought up and include fractures, luxation, and vertebral malformations. The vertebral pedicle and the body provide the largest volume of bone fixation and highest implant stability. The references used for this statement are the Sharp and Wheeler Spinal Surgery textbook and a 1984 paper describing the use of polymethyl methacrylate and Steinman pins in dogs with vertebral luxations and fractures. It is a straightforward statement. However, looking through the latter reference, I never found this stated in the article. This doesn't take away anything from this article presented here, but it does highlight the importance of checking the references. Ventral and lateral approaches are uncommonly performed in veterinary medicine, especially in the thoracic region due to the need to traverse the thorax and the close proximity to some of the great vessels. Implantation corridors have been calculated for portions of the canine spine and illustrates the narrow safety margin. Corridor widths are described very well in the 2006 paper that's titled CT Study of Implantation Corridors in Canine Vertebra, which is reference 8 in this paper. This is a fantastic reference for anyone doing spinal fixation and emphasizes the narrow margin of error and risk of violation of the corridors, leading some neurosurgeons to recommend against doing the dorsal stabilization and why other techniques such as spinal stapling and the looper plates are performed. However, these techniques are considered biomechanically inferior to the use of pedicle and body implants. Thus, patient-specific 3D printed guides have promised to improve implant placement accuracy in the vertebral pedicle and body. The study objectives were to use canine cadavers to plan and print the guides to simulate a realistic surgical approach to the thoracic spine and to measure the entry point and angular deviations of drilled trajectories from planned trajectories, as well as the frequency of unintended cortical breaches. The group also compared drilling accuracy for a surgeon with experience and for a surgeon without experience. 5 cadavers were used in this study. To summarize imaging and guide designs, the DICOM images of the T8 to T13 vertebra were uploaded into CAD software where the trajectory of the drill bit was planned and then drill guides were made as shown. The following images of the implants placed on the cadaver might be a little bit difficult for some people to see, so please skip ahead if that's something that you don't wish to see. The methods used in this study are very similar to what I use for 3D planning, and if enough people are interested, I can make a tutorial on how I go through making those guides, so please comment down below if that's something you would find interesting. For this paper, guides were printed using a photocurable resin inject printer with a polymer with wax support material. I am summarizing here, so please review the article for more details. Drilling was then performed on the cadavers and CT was repeated. Images of the pre and post drilled CT were then fused and drilling accuracy was assessed. For the results, 2 drill guides had errors during the printing, and so therefore they were not used, and this gives us a total of 58 drilled tracks being created for 30 different vertebrae, so that's why it's not 60 and why it's 30 instead. Overall mean entry point deviation was 1.4 millimeters, and overall mean angular deviation was 5.1 degrees. There was no difference between inexperienced surgeon and experienced surgeon. T8 had the largest entry point deviation, and there were no unintended cortical bone violation. Overall, I really like this study. It is a simple design and highlights some of the possibilities of additive manufacturing. I almost always use 3D printed guides for implant placement and for brain biopsies. As this study highlights, there is some degree of error when guides are used. Some of this is down to ensuring that the muscle is properly dissected away from the bone so that the guide fits properly. There is always the inherent imperfections of the CT scan and the print itself. If 3D prints are going to be used, some researchers suggest using a higher kVp on the CT settings to improve accuracy of printed models. There is also some thought that using axial scans versus helical might be better for 3D printing, but in my experience, I don't notice much of a difference on a 64 slice CT scanner, and standard settings seem to work very well. A comment I have on these guides used in this study is that I find it easier to hold the guides in place if I can use a point-to-point between the guide and the spinous process, especially if you are doing surgery alone. These guides would be difficult to hold on by yourself, so I would recommend extending the guide design up to the spinous process. Other methods have been described for holding guides to the bone for drilling, but I find this method using the point-to-points to be overall reliable, and they're a lot faster. Whenever I discuss 3D guides with other neurosurgeons, a topic comes up: is it even necessary? Because free-handed techniques were used for years and patients appeared to do well. But the reality is that we have no studies in veterinary medicine that evaluates the accuracy of implant placement when it's done with freehand. Whereas there's a lot of studies that have evaluated 3D printing now and also neuronavigation, so it's easier to criticize those methods versus using the freehand technique because there's no data out there on how inaccurate it is in veterinary medicine. But from what we know in people, we know that using some sort of surgical guide or neuronavigation is a lot more accurate than doing freehand. Now, for some dogs with vertebral malformations as well, where the anatomy is not normal, implant placement is extremely difficult, and having improved methods is absolutely necessary in those patients. Let me know your thoughts in the comments below, and I look forward to the next journal article review.